Thank you. And hi, guys that are on the phone. Thank you for calling in, and we appreciate your participation. This is not really a webinar. It's what we call a learning exchange. So that means that we won't be just presenting to you and talking to you, but we want to engage people in a conversation so that we can all learn from each other. So let me give you a quick history about this. So we did a webinar back in May called The Nuts and Bolts of Family Involvement. And then on that webinar, we did a poll, and we asked people what were some of the challenges around family involvement. And then we broke those challenges out into 4 learning exchanges. And so this is number 4 in our series of learning exchanges. And this learning exchanges is on evidence of family involvement in program planning, implementation, and evaluation. So we are going to have a discussion today around how do you know that family-driven practices are being done in communities and states? What is the evidence? And so I'm Sandra Spencer, and I'm the Executive Director of the National Federation of Families for Children's Mental Health. And normally on this call with me is Marie Narhost, but Marie's out today. And so I have 2 other staff members who are just going to help in the conversation today with me. And one of them is Teresa King, and Teresa does a lot of family engagement work with us, mostly with our Georgetown Technical Assistance Center. So welcome to Teresa.
Hi, everybody.
Yeah, say hi. And then Barbara Huff, and you all know Barbara Huff, who was the former executive director of the National Federation, but she's now working on our social marketing work with communities. So can you say hi to Barbara?
Hi, how are you? Thanks, Sandra.
So great, everybody. So like I said, I'm going to talk for 1 or 2 minutes, and then we're going to try to engage in conversation to see if we can really find out if family-driven practices are really happening in our communities, and if so, if you guys can give us some examples of what that is. But for a minute, I just want to introduce you guys to who the Federation is, just in case there's some folks on the call who are not familiar. So we're a national family-run organization, and what we mean by that is that we are parents and caregivers who have or are raising children with behavioral, mental health, and emotional challenges. And so we have a vision that all youth grow up healthy and maximize their potential. And we do that through a family-driven and youth-guided approach. And we just have a 3-fold mission, and our mission is to make sure that we provide advocacy on all levels for the rights of children with mental health issues. And we provide leadership and technical assistance, and that's some of what we are doing today, to our network of families and family-run organizations, and to collaborate with the family-run and other child-serving agencies. And so with that being said, this work on this learning exchange is a part of the work that the Federation does with the Technical Assistance Network. And a lot of you found out about this call because you get emails from the Technical Assistance Network. And so this is part of the work that we do with the TA Network. So our goal for today is to have a conversation to share examples of what working toward being family-driven looks like. And how do we know it when we see it? Because we have been talking a lot about family-driven care and family-driven practices and making sure that family voices are heard and that they're at every table in every decision-making body. And so we want to see what that looks like and if we have any examples. And then we also want to see if there's the evidence. So if it's happening in your community or in your state initiative, if families are involved in planning, implementation, and if families are involved in evaluation work, we want to know about it. So you all can unmute your phones to speak when it's time to speak, and we hope that we have a really good discussion today about family-driven care. So for a minute, I want those of you who are able to unmute your phone to introduce yourself to the group. And then tell us what role you play in your community, state, tribe, or territory. So can those of you on the phone unmute and introduce yourself?
Hello, can you hear me?
Yeah, we hear you.
Hi, my name is Ebony. I'm from Sacramento, California. I'm with an agency called Stanford Youth Solutions, and I'm the Director of Family and Youth Partnership.
Thank you, Ebony. Welcome to the call.
Thank you.
Okay. Someone else? Yes, can the next person introduce themselves? And Adam, can you remind people how to unmute again?
To unmute your line, you just press *1, and to mute again is pressing *1 again.
Okay, so I'm not sure if other folks can unmute and introduce themselves and tell us what role you play in your community. Maybe people are shy. Okay, well, I'm going to move on and go over the definition of family-driven care. And if you are on the phone and you figure out how to unmute and you want to chime in, please interrupt me so that we can get an idea of who's on the phone and what role you play so that we can have you join in our conversation. Like I say, this is not a presentation, but we're hoping that this is a conversation. So let's talk about real quick what is family-driven and what that definition is and what are we going to talk about. So we know that for years we've been working on what we call a living definition of family-driven care. And we said that family-driven means that families have a primary decision-making role in the care of their own children, as well as policies and procedures governing care of all children in community, state, tribe, territory, and the nation. And so this includes choosing culturally and linguistically competent services, supports, and service providers. And a lot of times when we read this, people are surprised that we say that families should have a say-so in who their service providers are, and to really gear that toward their cultural and linguistic choices. This also means that families can help set goals. And this is not just setting goals for your child and your family, saying, well, this is what I want my outcomes to be, but this is setting goals for that community collaborative and setting goals for that system of care. And what do we want to accomplish with all of our children who go through some of these programs and grant funding systems. And then families should also have a really keen voice in designing, implementing, and evaluating programs. And that's what we want to talk about a little bit today. We want to see if there's examples of families really participating in deciding what the program is going to look like, helping implement it, and then evaluating to see if it's effective, to see if the outcomes are right, see if families are getting what they need. And that's a part of the next bullet that says monitoring outcomes. And so we want families involved in that. And then last, but certainly not least, we want parents involved in making funding decisions. So as your community or your state or your territory is trying to decide, what best to put funds toward and what services to provide and what informal activities to provide to families. We want families at the table making those decisions. And so that's kind of what we mean when we say that practices should be family-driven. And so I'm going to move on to the first question, and I hope that we have some folks to chime in, and we'll try to think of examples. But in your work, in your community, whether you're with a funded system of care, whether you're with a family organization, whether you're with a state collaborative, or however you work within systems of care, what evidence do you see of family involvement in program planning? Is there any where you can say, when I look at this plan, or when I look at, it's like right now we have these one-year planning grants. When I look at the plan that these communities and state collaboratives have come up with, is there evidence that there were families at the table and that families were involved in that? So does anybody have any examples of where that is and where that's happening that you can see evidence? And I hope that it is happening.
Well, Sandra, this is Barbara. Are you there, Sandra?
Yeah, we can hear you. Go ahead, Barbara.
Okay. Since I'm there in the realm of social marketing these days. I always think it's one way of evidence in planning is in social marketing planning, to have families at the table in an ongoing way. Number one, developing the plan, but then number two, in revising the plan, in planning meetings, having an active role in that. And that's just one thing. But I think if you even stepped a lot of steps back and thought about the way these grants and cooperative agreements get written for systems of care work, lots of them are getting written at the state level to implement now, and then there's still some being written to begin to plan at the state level on how they're going to expand and implement plan for expansion of systems of care at the state level. And, it's not okay anymore to show the families what's been proposed. And families and family-run organizations need to be sitting right there during the planning to say, this is what we would want this to look like if we were trying to expand our system of care work throughout our state, or if we were beginning to write a planning grant to plan for it. And not only should they be there, but then they're going to be the voice. They're going to be the voice for what family role should be in all of that. So and families need to be supported to be there. They need to know what's possible. How have other people done this work, and how is it working, and is it successful, and what does the data say about what's working in systems of care, to see if that would in fact begin to translate into the work that you might be, your state might be doing. So there's a lot of things, but we also, I believe that family organizations need to have funding to sit at those tables to do planning. And so that way, not just the employees of the family organization are sitting at the table, but that you can bring in families who are right now out in the throes of things with their children with serious mental health issues. And they may not be paid at all by anybody, and so you want a grant that will support their involvement so that they can be paid a stipend or some something for their time and their energy and their effort in the planning along the way. So there's many more, and I'll let Teresa put her thoughts here on the table. Those are just some thoughts that I have that I've seen over the years, that I think that there's more success in families' ongoing involvement if they have been involved in the actual planning rather than just read what somebody else has said is going to happen.
Absolutely.
And I agree with Barbara. This is Teresa. And what I'm coming across and have been sharing with Sandra as we're looking to move forward, we hear a lot of anecdotal, that the family is not at the table. So that prompted this series of questions to have open dialogue amongst ourselves. Are we at the table? When the state, because the state, are being awarded these grants, how are they actively recruiting family organizations from throughout the state, not just one or two families in a certain city? And we're discovering more than not that is not being done. And so we can't just say it's not being done. We have to have examples and hard data to go back and then show that, yes, we have made a lot of strides, but at the moment, we're kind of getting lost. And we hear it from our families that we're providing technical assistance, but we need to start putting that in writing. So that's where some of the reasons for these calls, for these listening sessions, so we can talk amongst ourselves as we start trying to develop a game plan to put this information back out there, that we need to be in the participation, we need to be in the focus groups, brainstorming with the state as they go forward.
I totally agree, and thank you. And I noticed a couple of other people have come on, and maybe some other folks have unmuted your phone. If you have joined us, could you give us your name and what role you play in your community? And I think to unmute your phone is *1. Anybody want to introduce yourselves and where you're from? And you can also use the chat box. If you guys look up in your right-hand corner, there's a chat box. And I see Barbara Granger is typing a message. So some folks may be in listen only. So if you're in listen only mode, you can type your name and where you're from, and it will come up on my computer, and I can at least read that to the group. So I'll wait because I see somebody's trying to type in as well. Does anybody want to introduce themselves before I respond to that? Okay, so what Teresa and Barbara were talking about, hold on a minute. So we have Barbara Granger. She's from Texas Mental Health Resource via HOPE, and she's a family coordinator within her state. And so, Barbara, we hope that you can get so that you can have a voice on here because we see you typing. We also have, who just joined us, is Cynthia Daniel Hall. And so Cynthia may be on listen only, and so when she finishes, I will make sure to introduce Cynthia. So what we have noticed is that we've been talking about family-driven for a very long time, for over 2 decades, and talking about having families involved. But as TA providers, Barbara, Teresa, and I both are TA providers with all the communities around the country in one phase or the other. And we are not seeing enough evidence when we see, like Teresa and Barbara said, when we see things happening and plans coming forth, we're not seeing enough evidence that family voice is there and that they're involved and they're at the table and that kind of thing. So we really want to know, is it really happening? And how can we document that it's happening? And once you document that it's happening, then how do you know what impact it's having? So, you know, how do we know that families are doing this and that it's really changing systems, it's really changing practice, it's really changing programs? So does anyone on the phone, and I hope that people can hear, and usually we have a lot more people talking and their voice getting in, and I see a lot of people typing, so I'm not quite sure. But does anybody have any example of where you know that family voice is being heard? So we have Cynthia Daniels Hall on the phone, and she's from North Carolina, NAMI, Durham Young Family Programs and Special Education. And so I'm not sure if she's in listen only, but if you can speak, we would love to hear from folks tell us if they see any evidence of family voice in their program planning.
Because some of the things that I noticed as we're working with different states is they might have one family organization, but it's not a representative of really of the collective state. So it's hard to say that one family organization represents everyone. A lot of family organizations are starting to build coalitions together as they see that it makes sense to bring all the smaller organizations together to have a larger voice and impact. And so we would like to know if that's going on in your state. Once again, this is, you know, we're out there asking the questions, but we need the answers back from the field to really go forward.
Absolutely. So Adam has just provided in the chat box the phone number again so that people can be out of listen only. So if you are on here, can you dial in? Hello, I see somebody dialed in. Who joined us? Oh, we still can't hear them. Okay, so I'm going to read the comments that someone has made. We have organized a Texas Family Voice Network, and have been asked to present legislative recommendations focused on family-driven responses. So that is coming from Barbara in Texas. And so that's a really good example of using family voice to really move policy and legislative work. So thank you, Barbara, for sharing that. And that's another important element, because one of the things that I know that systems can use families for is a lot of times if you work for the state or federal government or state and local government, you can't be in that position where you can advocate and talk to your legislators. But families and family-run organizations can do that. So that is an evidence of one way that families are involved. Is there any other example? I put in program implementation. And what we mean by program implementation is, so now that your system of care has gotten a grant or it's gotten funded, or you're in a community where they're doing children's services, are they engaging families in implementing that plan and implementing services? Are any of you in a community where they're using parent support providers or parent support partners and having those parent support partners work with the families to implement the systems of care? Are there any evidence that they are actually using families to do this? And I see a little bit more typing, so.
And question for Barbara, how many organizations are in the Texas Family Voice Network? I'm just curious, and how did the state reach out to you guys? Because some other states might want to know how to form their own network and what questions or, you know, who to go after to kind of form those type of things.
Exactly. And some other people have joined. If you've joined the call, if you would like to introduce yourself and tell us what community you're with or what role you play, we would love to see who's on the phone.
Hi, this is Jerry Melindor. I am with the Oklahoma Systems of Care. I'm the lead family contact.
Hey, Jerry, welcome.
Thank
We're
you.
talking about finding evidence of family involvement when we do work with communities, and we're wanting people to engage in us in a conversation about what evidence we see. Some people are doing that through the chat box, and we hope that some people will be able to unmute their phones. So, Jerry, I know you do a lot of work in Oklahoma. So I'll give you a minute to think about if you have any examples of when families were really involved in planning or implementing and you could see evidence of that. So that's what we're trying to think about now.
Can I, because I could just jump out here really quick on...
Oh, we would love for you to, absolutely.
We have our state advisory...
to do this. That's great.
We have our state advisory team, and Oklahoma's been very, very fortunate that we had a Phase 4 grant, and we actually started Systems of Care before we were ever federally funded. And one of the things that we started off in the very beginning is actually having family members on the state advisory team, and they have, we have several different slots for family and youth, and it doesn't matter whether you're the voting member or the designee. If you attend the meeting, you're at the table and you have a vote. I would say we probably have 30 members of our state advisory team, and easily we have 15 family members, and then our youth. I mean, we have more people as well, but that's one of the things that we do is having the state level family members that attend every month, because we have our monthly meetings.
Right. Well, Jerry, how do you all prep your families to be able to sit on those levels of committees and in those meetings?
Well, can I say
sure?
Yeah, can I say that it's a developmental process?
Yeah.
Because our first families, there wasn't anyone else that prepped them other than themselves, and they work together. Now we have orientation to our state advisory team every year, and it really doesn't matter whether you're a family member or just another member. We always do our orientation, and it usually is our senior project director, who is also, by the way, a family member, and myself, or our one of our family leaders that we contract with in Oklahoma. We have one of our family groups provides technical assistance for our local systems of care community development teams. And then we have another organization that we contract with, actually two other organizations that we contract with for the family peer-to-peer components out in the local areas. And we have another family organization that works with our sibling groups that helps provide support for our siblings.
Oh, wonderful. Wonderful.
But it's
Great.
a developmental process.
Well, it is. It is. So I'm going to read from the chat box for just a minute. So Barbara Granger was answering Teresa's question. They have around 25 groups, and we are growing, which is wonderful. Our System of Care Program Director reached out to key family leadership to begin to see how we as families can find a stronger and collaborative voice. This network started out as a subgroup to our System of Care Consortium, which is legislatively mandated. Wonderful. So, yeah, thank you so much for that, Barbara. You know, we would love to hear more about that, and if there's anything you could send to us, and I'll put my contact information up soon. We would love to be able to share these kind of things out among some of the other families. We would love to know how you got your consortium legislated to have families on it, so that's great. And also we had Phoebe Malloy join, and she is from South Carolina. So Phoebe, we hope you can call in. If you look in the chat box, there's the ability to call in. Somebody else just joined. You want to introduce yourself? Okay, great. So we know that everybody, and I hope that you guys can see the phone number in the chat box. So if you're not able to talk and you need to figure out how to call in, that's the number. And if you're muted and you need to learn how to unmute, then it's *1 to unmute your phone. But thank you so much for that. So the other question is one that I'm really curious about, because for the past 10 years on different contracts, the Federation has been involved with the national evaluation. And one thing that we know that the national evaluation does is it collects data around those families who are served in systems of care. But one of the gaps we think in the national evaluation is that they don't always ask families what questions they want answers to. So while we are getting data around how many kids are being served, we get data around what their racial and ethnicity is, how long they stay in the system, when they enter, when they exit. We get a lot of this kind of data. But we want to know, if you ask families what kind of research questions you need to be asking, and we ask those questions, what would those questions be? And how will we know that families are really involved in evaluation? And so, for example, it's not just enough for me to know that 30 children were involved in the first year in a system of care. I want to know, out of those 30, how many of them completed school, stayed in the whole year, did they have far less of school suspensions, you know, did they develop the capacity to have more socialization, were they able to participate on formalized teams? These are the things that seem a little difficult for our children, you know, when they have special mental health concerns. So can you use the chat box, and those of you who can talk through your phone, is there, number one, any evidence that families involved in evaluation? And if families were involved in evaluation, what kind of questions would we ask? What is it we would want to know?
And some of the things that I know, as we're building a new workforce of peer support, how does Do your state or your community have peer support, and how is the work they do being captured and being fed back to the whole process?
That is a good question. What else would we want to know, guys? Some of us are family members, and we've had our children treated through the system, and there's a lot of data. So I'm going to read one from the chat box. There's one question that our families have told us they want to know is if you feel safe to sleep at night. Wow. That's an excellent question. And we certainly
what was it again, Sandra?
It's asking the child and the family, do you feel safe to sleep at night?
Mm-hmm.
It's a question around community safety and family and at home safety. And thank you, Jerry, because I had never heard that question before, but we certainly can pass that on to some of our evaluation partners. Excellent.
And that happens more than you think, because as you know, as a parent, I just wanted a quick story. I was a very heavy sleeper, but going through some of the things and raising my son, I had to be aware not only of his moods, but very light sleep, become a very light sleeper, so I know what was going on. So I totally get that question. Do you feel safe to go to sleep? Because you don't know sometimes what's going to happen in the middle of the night, and no one would think to ask that question but another parent who has been in that position.
Right. Yeah, I really like that question. I would love to see where we go with that in some evaluations. And maybe the families and the children and the youth would expound on their answer, because one of the things that I do think that they try to look at in the evaluation data is how many kids live in poverty, how many kids live in rural versus urban communities. And so if we were asking those type of questions and then feeding it through that other data, you know, maybe when we go back to the question I asked about families being involved in planning and implementation, maybe a part of the plan would be how do we create more safer environments. So, I mean, see, everything that families want to ask and the questions that we need answers to, I think it really can go back to really serving our children and families better. So what else, as family members, if you could tell the folks at the National Evaluation Center, you know, this is what I want to know. I'm working with families, I'm serving children. This is what I want to know about the system. And just to make another announcement, I see several other people join the call. If you have just joined and you didn't get a chance to introduce yourself, you can dial in and tell us your name and where you're from at any time, because this is a discussion, not a presentation. So what other evaluation questions would you guys want to know? Is there anything around schools? Is there anything around involvement in the juvenile justice system? Kids involved in child welfare?
You know, Sandra, this is Barbara Hupp, and I know that they ask questions that in terms of school, they ask questions about, you know, is your child, you know, what about their performance? They ask about whether or not they're making school improvements, whether they're graduating. They ask some of those kind of questions, but I don't know if they ask any question about a child's socialization at school. I don't know if they ask questions about whether or not the child feels supported enough at school, or whether they're getting what they need from students, teachers, you know, and that sort of thing. And if not, what is it they need? I don't know if there's much asked about socialization. And Jerry, for people like you that have been around for a long time, you may know the answer to that, because I don't ever get to see, you know, some of those evaluation questions. I saw some of the original ones early on, but I have not seen if there was anything more developed. And, it just also seems to me like, I know it sounds real general, and I know we don't know what better means, but I think it's up to the family as to what better means. But it seems like there should be more questions about whether or not the family feels like they're doing better as a result of systems of care. Are they as a family,
Yeah.
and what does that mean to them? But do they as a family feel like they're doing better? I know myself, we were divorced through, all of Christy's mental health challenging times and all of that, and we weren't doing well as a family. But we also weren't part of a system of care, but nobody really ever asked us how we were doing. It just seems like, you know what I mean, Sandra?
Yeah.
And I don't have exact
exactly.
questions for that, but it seems like you'd want the answer to it somehow.
Yeah, I think so. It reminds me when my son was 8 years old, and we were having our child and family team meeting, and we were all sitting in a room talking about him, what was best for him, what he needed, and nobody ever looked over, even as he was 8, looked over at him and said, so what do you want? What are your goals? But when somebody did say, Stephen, what do you want? He simply said, I want a best friend.
Yeah.
And I think it stopped all of us in our tracks because we had not asked any questions around socialization. And what does an 8-year-old want? He wants the best buddy. He wants somebody that he can walk to school with and play on the playground with. And he had some social issues around, having friends. So I think you're right. I think, we need to be asking those kind of questions and finding out from the children and the youth and the young people themselves, because I think they really do know, but we don't ask those kind. I think you're right. So that's something we can take down.
It's probably more qualitative and quantitative, and so I think that's probably why they don't ask them, because they're kind of vague.
Okay, this is Teresa, and I know what goes on in Ohio. We did a caregiver string and a youth strand as part of the evaluation. Now, that was part of our local evaluation. That wasn't what the national required, but locally we required that, and that answered those kind of questions, and also the questions that Barbara has written up. We did ask, does this feel personal for you? Is it appropriate for your family? So some of we was able to take local evaluation dollars and answer those questions. So I'm curious for the other people on the call, how, since the national evaluation wasn't asking those questions, was your state or your community, did they use their local dollars to kind of get to some of those questions? And Jerry, I know you're on the state level, so how did you use your local evaluation dollars? I'm curious to answer some of these questions, because I know you guys do answer those questions.
Yes, and even though we're state, our grant, the way it looks, is like a lot of other local people, because we replicate in our local sites what is required of us by the feds for our, the local, which is actually our state. That makes a whole lot of sense. We've used the Ohio scales for a long time and had gotten permission to ask some Oklahoma-specific type information as well. But one of the things that we've been doing for a while, Geneva Stretch is our contact at the OUE team, our evaluators, and her and I work real close together. We've been doing focus groups whenever we can, just about at any time we have an opportunity to, at different conferences, and we ask parents, what do you want to know? What's the best way for us to do this? She actually has sat down with me, and I've seen the original for Phase 6, what the national evaluation looked like, and it's pretty daunting, and some of the questions are not very family-friendly whatsoever. And it's really kind of funny, because after gathering information for a little while, she came out with a draft family assessment, tried to make it really, really small and short and to the point, and it's actually, I have it in front of me right now. My family spends too much time arguing. We don't know how to work problems out. I don't feel safe in my home. It's hard to know what the rules are in my family. We don't trust each other. You can't say what you really think in my family. My family is there for me. I never know what to expect from my family. It's okay to talk about my feelings with my family, and my family doesn't spend enough time having fun. Those are things that was just a really quick, short information that she developed in regards to what we have been told by families when we went out and did our focus groups. And the really cool thing about it was we took that, we just recently had our Children's Behavioral Health Conference about 2 weeks before we left to come to the Georgetown Institutes. And our evaluators bought the family and youth lunch one day of the conference, and we passed this out and we had a discussion, and the youth had more to say. So when Teresa said that, I was like, yep, or Sandra, I don't remember which of you. They were like wordsmithing and changing it around. Said this is not strength-based. This is not wraparound. This is not strength-based.
Right.
So we haven't gotten back together to go back over this and look at it, because I remember the first time I seen it, I kind of felt that same way too. But it was great because it came directly from the families and the youth, and some of the families took the assessment, and some of them let their children take the assessment, and then they got to write it, just really tear it up and stuff. And that's one of the things that we do. But I really like some of the questions that Barbara Granger has listed up here. I'm going to make certain that I let our E-team know about them, because Friends is one of those things.
Oh, I'm sorry. Did I interrupt?
I'm sorry.
Now, I know everyone is not on the webinar portion, and Teresa read some of them. I'm going to read Barbara Granger's questions because they're really good ones. And we, like I said, the Federation works with the National Evaluation Team, and we can certainly share these. But I think that you also should be sharing these with your local evaluation. So some of her questions is, does the care feel personal? Are the services you receive appropriate for your family? Were the services you received customized for your family? Did you have a say in your services? And did you feel like your concerns were addressed? So I think those are really good questions that we should be letting our evaluators know that we want some answers to. So any other thoughts around that? So anyway, this whole learning exchange and this whole conversation really has been about how do we know that families are involved, and how do we know that family voice is being heard. And one of the things that that's happening nationally through other groups, not just with Systems of Care. I belong to another group of family members who come out of education, who work with school-based mental health program, and they had a conference call yesterday, and one of the focus agenda items was why family voice is being diminished through some of the education grants that they are working with, and how for a while people were really in tune with and in key that we had to have family involvement, and we had to have family voice, and we had to have families at every table. And then it seems like people got comfortable, so okay, well we have family voice now, and stop really making it a priority, and stop making sure that families were at every decision-making table. So I think not only are we having that conversation here, with Systems of Care, but across multiple systems. So this is not one of the questions on here, but I would like to ask this question and have people talk over the phone or put in the chat box. Have you, in where you live and work, have you seen any diminish activity from family members within your system of care, your planning, your state, or your local initiatives? Is there anybody who can say, well, we've had increased family voice or increased family participation, or would you all say that you've noticed a little bit of a decline or a little bit of decrease in family voice because people are kind of laid back and think that they're comfortable? So I see some folks writing, and I'm going to wait. And can anybody talk to that over the phone, those that are not muted?
This is Jerry. I would say here in Oklahoma, we've put a pretty big emphasis on family involvement. Are we where I want it to be? No. I don't know that we'll ever be where I want it to be, but I think that's what we've done is, we take little baby steps, and as we take baby steps, we keep looking for that ring that's further out. But one thing that I did hear, and I had the opportunity to go to the institutes, is a lot of people think that we've done the family involvement stuff, and, we've done that. And it's like they're settling. And I believe I understand that some of the grants that's coming out aren't asking for the family input like some of the others. And that is just, for me, it's devastating to know that we've worked so hard that now I can pick the phone up and say, hey, I have a senator that's holding up a bill in Washington, D.C. Can you give us a call, give us some support, and this is what's happening. Can you call your senator? And for the other people that think that it's been done, it's unfortunate because it isn't finished.
Yeah.
I don't think it ever will be finished.
Yeah, I think there's a continuum, and we always want to continue to move forward. So I'm reading from Barbara again, and Barbara is from Texas. She said that they're definitely having an increase in family voice within their system of care statewide. So she said their families are feeling empowered. So that's really good to hear from Texas, Barbara. Thank you for that.
And one of the things that I know is happening, just like Jerry said, people are really, doing status quo. Oh, where the families are covered. Let's hear the youth voice. Well, we're saying that the families are not covered, that we're still trying to make room and get to the table. And that's where we need, once again, we need the voices from the field to really put in writing exactly what's going on out there. Because, as I said, we hear it anecdotally, but we don't have it in writing, so we don't know. And the way the planning grants are going, there's not a position that is mandated, as there was with the System of Care 6-year grants.
Right.
Now, the family voice is not mandated, so we have to stay vigilant and work that way back into the conversation. And the way we do it is with numbers and show them this is how it's affecting the families, not being mandated. I know we like to say everybody welcomes families to the table, but how are we actually showing it?
Exactly, and we do need that evidence, and we need the hard data, everything. Like Teresa, I'm going to echo you, Teresa. We can't keep just having anecdotal things. Phoebe in South Carolina said that they're in the process of establishing a family involvement work group to establish criteria to monitor and ensure that as they develop their system of care, that the process is truly family-driven and you've got it. So they're going to do a family involvement work group to make sure that happens. And so I think that's good, and that's in South Carolina. So that's excellent, because we have got to get this over into getting some data. And other comment I'm going to make about making sure that we have data is how much funding is tied to data. And if people know that something is working, that it's valuable, that it has an impact, people are more apt to continue to fund it. And I think right now a lot of our family-run organizations and a lot of our families who held positions within systems of care as lead family contacts and family advocates are having a hard time when those systems of care are not federally funded, keeping their positions or keeping their family-run organizations funded at the same level. But I think if we had really good data, really good hard numbers around this really does work, and you really do need family voice to improve systems, to improve outcomes for children and families, then I think we could really move forward on that. So,
You know, Sandra, this isn't exactly about having evidence and data, but it kind of also shows us with our Phase 6 grant, there was a training offered about families and evaluation. And I can't begin to tell you how much I learned whenever I went to that. And, you know, data and evaluation was like I was sinking underwater until I went and, you know, learned about data and evaluation and just actually love it and bring it up all the time and try to help families understand the importance of data and evaluation as well. And you know, that's one way to have your voice heard, even if you aren't at a place to where you want to join our state advisory team or the community team, your voice still matters. And one way to make your voice matter is that evaluation. And I had at the Institute several people asking me, "You're a family member? And you know this?" I'm a family member because I learned how to do this because I went to this training. And I kind of refer it back to the Federation training that you guys used to be able to have that was funded, that is now no longer funded.
exactly.
I remember that,
You know,
Jerry. I know Sandra does too. It was good
Oh,
training.
I do. And, you know, we are trying to revamp some of those trainings. We just completed updating one of the trainings we do as evidence as co-pilot, and that's teaching families and evaluators how to work together to do evaluation. And so the only thing now is with all the federal government mandates of no conferences and no travel, we're going to have to turn those trainings into, you know, webinars and those kind of trainings. And we found that that's not as effective for adult learners if everything is virtual. And so, you know, I hope that soon, you know, things can go back to having face-to-face trainings and having people in the same room at the same time getting information, because a lot of families and youth used to come to that evaluation training. And so we would love to keep that going again. But I think you're absolutely right. So on the screen right now, I just had a few lists of some resources that's available on the Federation's website. And since you mentioned it, we do have that workbook around data-informed and family-driven decision-making, and we've redone that evidence as co-pilot. So that's a really good resource to help families participate in evaluation and training. And then there's another document that's called Indicators of Family Involvement, and it's just a document to help you as families and leaders and project directors kind of do a self-assessment of yourself and say, where are we in family involvement? And it gives you some indicators, and the links to those are here. And so at the 2014 Federation Conference, we will have a lot of these documents updated, and we will be, some of them will be in print form that families can take with them, and we'll do a couple of workshops around those. And speaking of the National Federation Conference, we want everybody to make sure that they save the date. The Federation Conference is still in November this year, but it's at a different hotel. We're at the Omni Shoreham. And the main conference is on November 21st to 23rd. And then we're having 2 pre-conference events, which is Policy Day and the Parent Support Provider Institute. So we hope that everybody is marking their calendars and planning to join us in Washington, D.C. in November. And we are just a minute over our time for this webinar. I'd like to thank Teresa King and Barbara Huff for helping me facilitate, and I'd like to thank all of you guys who joined the webinar today. Thanks for your listening and participation. We will be able to save all of the notes in the chat box so that we can share those. And so I hope everybody have a good afternoon.